In this video we are going to learn about investigations and treatment options available for unstable angina using a mnemonic N. Stable angina. N. Non-invasive imaging. Non-invasive imaging techniques, such as stress echocardiography or nuclear imaging, for example, myocardial perfusion scan, can provide valuable information about the blood flow to the heart and the presence of any blockages in the coronary arteries. Serum biomarkers. Blood tests are performed to measure specific serum biomarkers, such as cardiac troponin levels. Elevated cardiac troponin levels indicate heart muscle damage, which can occur during episodes of unstable angina. Thrombotic markers. Additional blood tests may be done to assess thrombotic markers, such as fibrinogen or D-dimer, to evaluate the risk of blood clot formation in the coronary arteries. Angiography. Coronary angiography is an invasive procedure where a contrast dye is injected into the coronary arteries, followed by X-ray imaging. It helps visualize any blockages or narrowing in the arteries and provides guidance for further treatment options. Blood pressure monitoring. Regular monitoring of blood pressure is crucial in evaluating and managing unstable angina. Lipid profile. Assessing lipid levels, including cholesterol and triglycerides, can help evaluate the risk factors associated with unstable angina. ECG, electrocardiogram. An ECG is a commonly used test to evaluate the electrical activity of the heart. It can help identify any abnormalities or changes in the heart's rhythm and detect ischemic changes that may indicate unstable angina. Now for the treatment part, we are using angina part of mnemonic. Antiplatelet therapy. Antiplatelet medications such as aspirin or clopidogrel are commonly prescribed to reduce the risk of blood clot formation in the coronary arteries, which can trigger unstable angina or lead to a heart attack. Nitroglycerin. Nitroglycerin is a medication that helps relax and widen the blood vessels, improving blood flow to the heart and relieving chest pain, angina. It can be taken orally, as a sublingual tablet, or as a spray. Glycoprotein IB/FIA inhibitors. In severe cases of unstable angina or when undergoing certain interventions like angioplasty or stent placement, glycoprotein IB/FIA inhibitors may be used intravenously to prevent platelet aggregation and further blood clot formation. Interventional procedures. In some cases, unstable angina may require immediate intervention to restore blood flow to the heart. These procedures can include percutaneous coronary intervention, PCI. It involves using a catheter to open up blocked or narrowed coronary arteries, usually with a balloon angioplasty, and may include stent placement to keep the artery open. Coronary artery bypass grafting, CABG. CABG is a surgical procedure where healthy blood vessels, often taken from other parts of the body, are used to bypass blocked or narrowed coronary arteries, restoring blood flow to the heart. Newer antiplatelet agents. Alongside aspirin, newer antiplatelet agents like ticagrelor or prasugrel may be prescribed for more potent platelet inhibition in specific cases of unstable angina. ACE inhibitors or ARBs, angiotensin converting enzyme, ACE, inhibitors or angiotensin receptor blockers, ARBs, are medications that help lower blood pressure and reduce the workload on the heart, thereby improving symptoms and outcomes in unstable angina patients. That's all for today. Thanks for watching. What should we cover next?